Hello again. My name is Laurie Pepin, and I'm a certified lymphedema therapist. So let's talk about known risk factors, and most importantly, what you can do to reduce your chance of getting lymphedema. Risk factors for lymphedema after breast cancer treatment include the amount of axillary lymph nodes removed at the time of surgery. Obviously, this will depend entirely on the staging of your cancer, as later cancers will require an axillary node dissection to determine if your cancer has spread. If you have an early stage cancer, you may not have to have any axillary lymph nodes removed and may only have 1 to 3 sentinel node removes in what is called a sentinel node biopsy. Studies have shown that only 1 to 5% of women who have a sentinel node biopsy will develop lymphedema. For people who have an axillary node dissection, the rates vary from 20 to 40 and sometimes even 60%, again depending on the extent of your surgery and other factors. 2, exposure to radiation therapy. Radiation can cause scarring and blockage to lymphatic vessels on the chest wall, which may increase your risk of lymphedema later on. The third factor is a combination of axillary node dissection and axillary radiation, which is typically done if you've been diagnosed with a later stage breast cancer or inflammatory breast cancer. A fourth factor is either a localized infection of the chest wall or axillary area or delayed wound healing in the surgical areas. This could include the formation of multiple seromas that have to be drained in the chest wall. Two other factors are smoking and being overweight. Let's return to how do you prevent injury infection to the arm? Because these are triggers to lymphedema. First, treat infections at the at-risk arm and hand right away. When you're gardening or doing housework, wear gloves, especially if your hand will get really dirty or may have a chance to get cut or scratched. Keep your skin clean and well moisturized. When working outdoors, use insect repellent to avoid bites and bee stings. If you're getting a manicure or cutting your own nails, use a cuticle stick to push the cuticles back when they're soft. If you do have an injury, especially a puncture wound or bee sting that breaks the skin, wash the area off with soap and water. And if you have access to it, use hydrogen peroxide. If you suspect you have an infection on your arm, or you start to have any of the symptoms of lymphedema, contact your doctor, as you may need antibiotics to treat the infection. There are also several common misperceptions of possible causes for lymphedema that have been disproved with research observations. For people who do not have lymphedema, these include air travel. Several studies have shown air travel and the length of flights do not appear to increase your risk of lymphedema. Heavy exercise or using your arm to lift things will also not cause lymphedema. In fact, some research studies have shown that people who exercise more with their arm had a decreased incidence of lymphedema than those who were sedentary in comparable groupings of people. The third misperception is getting blood pressure measurements done on your at-risk arm. The last misperception involving lymphedema causes is increased heat and temperature. We now know that heat alone will not make you have lymphedema. However, if you do have no lymphedema, you do need to avoid saunas, hot whirlpool baths, and you need to avoid having your arm get sunburned. It's highly recommended you wear both a compression sleeve and a compression glove on your hand when you travel by air for long flights, as the change in air pressure naturally causes our bodies to swell, and that can increase your lymphedema swelling. Lymphatic surgery is an emerging field. The goal of lymphatic surgery is to prevent or treat lymphedema in one of two ways. Lymphatic surgery is performed by trained plastic surgeons using microsurgery and supermicrosurgery techniques. The good news is that these surgeries offer hope for the future, even if they may not be available for several years. In the meantime, if you've just undergone breast cancer surgery, follow the risk reduction practices. The good news